1.
Thank you. This is Dr. Frank McMillan, Jr. This is the North Andover Board of Health. It's 7:01 on April 9th. This is a general meeting, not a public hearing. Before we open the meeting, I'm just going to read a statement pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Laws, Chapter 30A, Section 18, and the Governor's March 5, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the North Andover Board of Health is being conducted by remote participation. There will be no in-person attendance of members of the public permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by watching it on the television or by visiting www.northandovercam.org or despite our best efforts, we are not able to provide for real-time access. We will post a record of this meeting on the town's website as soon as we are able to do so. So, the minutes of the prior procedure have been distributed. Are there any corrections to the minutes?
No, they've been distributed, critiqued, and I make a motion that they have approved.
It's been moved. Is it seconded?
Second, Michelle.
Moved by McCarthy, seconded by Davis. All in favor, say aye.
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 Any opposed, no. The ayes have it. The meeting minutes are approved. Since we do not have a flag in front of us, we will defer the Pledge of Allegiance to the next in-person meeting. I am going to next open the meeting up for discussion. We are going to first hear from Brian LaGrasse.
Thank you very much. I'll just give you guys just a brief little update. It's been a couple of weeks since we've last talked in a public forum, but a lot's gone on in the past couple of weeks, as you guys know. I think 2 weeks ago when we first had our special meeting, there was probably around 300 cases in Massachusetts. As of 4 o'clock today, we are up to just under 20,000. So there's been definitely a sharp increase over the past couple of weeks. I've been watching the numbers and kind of plotting a curve to see how we're doing. Essex County is actually doing really well in terms of overall numbers and the sharpness of the curve. But essentially Massachusetts for the past couple of weeks has been jumping up incrementally every day. It was under 1,000 for a few days, and then it gets up to about 1,000, 1,100, 1,200. Then daily it goes up to 1,400, 1,300, 13, 13, 15. And this last day it jumped up almost 2,200 cases in Massachusetts. Obviously that's a result of the increased testing, the rapid tests that are getting out there, the testing clinics, the drive-throughs, as well as it's a lot more community spread at this point. And we're starting to see those numbers reflect in the overall state numbers. I'm going to let Caroline talk about individual cases here. I think we're over 60 at this point. And she's working on the monitoring of the isolations, close contacts, quarantines. I know that they did just change over to a 48-hour or 2-day contact tracing back prior to people being symptomatic. So they're thinking people are spreading it prior to showing symptoms. And the way they explained it the other day on a state conference call was it's your basic parabola, your bell curve, where you have the outliers in each end. So not everybody is spreading it before they're symptomatic, but there are outliers and there are cases that are. And that's kind of how they're explaining the large jump in community spread virus at this point. As a department, we're participating in multiple state, local, and regional conference calls several times a week, as well as town staff. We are responding to emails and voicemails that are still coming in on the COVID hotline for the town. We are still talking to businesses and employees with questions and concerns. They're calling us with a variety of questions and employees about their employers and things like that. We did get out some guidance this past week to seniors in social distancing. We added it into the Meals on Wheels program so that everybody who is not online and is part of that program did get copies of this. Just give them some basic tips on what it means to be isolated and not going through their daily routines of coming to the senior center and interacting with their peers. So some tips on how to deal with the stress and the isolation that they're going to be going through at this point. We also included some small bottles of hand sanitizer in their meals, so trying to get some safety precautions out there as well. We did get out some guidance for condo complexes and multi-unit dwellings for management companies as well as residents, just in terms of what to look for in common areas, laundry rooms, mailbox areas, things like that. So hopefully that helps give people some ideas on how to stay safe. Um, Stephen has been working on one for mental and behavioral health as well. We had that reviewed by Deanna, who is our community benefits manager, and she gave us the green light to go ahead and get that out there. We also did a small business handout that has been going around to the different restaurants and giving out to small businesses for grant funding that's available now through the state to help them with mortgage and rent and employee payroll, things like that. Seems like it was needed, so get that out there. We just got one out today on how to make masks. So I know a lot of people are looking for the cloth masks that are reusable. So we got a handout sent out today on 3 ways to do that: sewing and non-sewing methods from the CDC. So Steve did a great job pulling that together. We have one in the works also for proper use of PPE. We've all seen the pictures of people eating chips at the grocery store wearing gloves, which kind of defeats the purpose of actually wearing gloves. Um, the governor did come out this week with limits on number of customers in stores, in grocery stores specifically. So we're working with the grocery stores on that. They all have their own internal numbers that they've been working with. Stop and Shop was the last one to do it. They just did it this past weekend. So we're all set there. We're still getting complaints about people at the parks and fields, mostly kids, uh, being too close, not 6 feet apart, things like that. So we're trying to keep an eye on that. I've been out there trying to monitor that a little bit. The newest one is people walking in opposite directions around the common, which we can talk about to get a board recommendation on that. But people walking in different directions, the town common is really busy during the day with a lot of walkers and dog walkers. So we can discuss maybe putting up some signs to have people walk in one direction, which would limit the face-to-face exposure. The timing, obviously, we've been hearing that between the 10th and 20th is going to be the peak. Looking at the numbers go up, it is definitely rising, as I said before. Where the peak is, hopefully it's soon. And right now, from the reports that I've been getting from other officials here, is that some of the hospitals are at capacity or right below it. So we're at that tipping point. So hopefully the social distancing will keep the numbers in check and keep the spread as slow as it is right now, and keep the hospitals in line with the number of people coming in, being able to handle everything. Let's see. So I also spoke with a doctor, Dr. Zapata, just the other day. He is looking to do a drive-through clinic, just like the Minute Clinics for the CVS is sponsored in Lowell, over here at the Doctor's Park in Andover by the North Andover Andover YMCA. He's working on some logistics now. I spoke to him. He's very excited. He's trying to get his hands on enough rapid tests to open up. He's got buy-in from a lot of the local stakeholders, and hopefully he can get that up and running sometime next week. And then and he also indicated that all first responders and healthcare workers and their families would have access to free testing. Lowell has just opened up one through CVS down at the Showcase site. That is same-day testing, through CVS.com. It's a rapid test, so we can find out within 15 minutes and kind of go on from there. So we did promote that on social media, and we are taking just general complaints as they come in and trying to deal with them, just in terms of takeout and delivery questions and answers, things like that. So that's been pretty ongoing. And I think that is pretty much it for general update. Obviously, there's some things we'll talk about during discussions as the meeting goes on, but that's a quick little synopsis of what we've been facing here.
Okay. Before we kind of open this up, what I'd like to do is I'd like to hear from Caroline and Steve as well. Why don't we go to Caroline next if you want to make any points?
Sure. I think Brian touched upon some of the changes at the state level, the criteria for screening close contacts. So if someone comes back as a positive test, when we do our contact tracing, we're typically asking, you know, who have you been in close contact with when your symptoms started? Now it's who have you been in close contact with 48 hours before your symptoms started. So it kind of capturing a time frame there that a lot of people, you know, will still be going to work and still be, you know, around people because they don't know they have any symptoms. So it's going to be capturing a lot larger of a contact list. But I think for the most part, people have been staying home and pretty aware of, you know, trying to keep their social distance from people for the most part from what we are seeing. Testing times have improved, so we're seeing 48 hours typically. The last few days, it's been a day to, actually today I saw the first lab come through that was taken this morning and we got the result this afternoon. There's still some lag time with some of the lab reports not getting in, you know, in adequate amount of time. So our numbers right now are 67. That's as of today. Yesterday we had a jump with 10 new cases. Today it was 5. Increased activity in the long-term care facilities. So I'm working with them and the state trying to make sure. I mean, they've been really great. They've had everything in place since like this first or second week in March, where they were already screening staff for temperatures. They were, you know, wearing masks, gloves, that kind of stuff. So, so just kind of making sure they're in, have everything they need in terms of PPE and information and whatnot. So that's pretty much it for me.
Thank you. Steve, have you been still going around the businesses doing education? Can you update us on what you've been doing?
Yeah, so Brian kind of touched on the PSAs and stuff. We did one for the seniors on social distancing and COVID-19 with just some resources on planning ahead, connecting with friends and family, some mental health, and just other general resources. And we had some other resources as well and PSAs that we're working on. One, like you said, that's coming up. We are working with some of the emergency management guys too on it regarding just general PPE, like single-use gloves and masks. We got that one out to apartment complexes and like shared living facilities, so like condos and other similar units, just to kind of keep them aware and give them some pointers and different areas to look towards and educate the management and the residents. And then, yeah, so yesterday I went out to a bunch of local businesses. I had a handout regarding just some different kinds of aid that could hopefully help them out, whether it's financially or in a different way. I did want to say thank you to Andrew Shapiro and Deanna Lima for the help with that and helping get that handout together. I was kind of talking with them too, and just talking with them as well about making sure they have enough stuff like gloves and sanitizing equipment and other things of that nature, just to make sure they are keeping everything clean and just see what they're doing as far as regularly wiping down commonly touched areas, or when they have customers and then they have a lull, making sure they're cleaning those areas too. And then I've been in touch with the grocery stores a bit too, just checking in on them, seeing how they're doing. They have said, thankfully, as of late, even if they get lines out the door, that people have been generally pretty good about keeping their space from one another and socially distancing even while waiting to get in. And they haven't run into too many issues. For example, people have also been following that the state suggested a one-way aisle. So if you have like different aisles in grocery stores, have them all go in either one direction or the opposite of the one next to them, just to kind of keep people moving one way so they're not crossing paths and stuff like that as much. And so the managers I've talked to have had pretty good feedback so far, so that's good.
Okay, well, thank you. So based on some things that have come up, I have just a few things that I wanted to discuss. One of them was the gloves and masks. The glove litter is unbelievable. If you've been in a parking lot at a supermarket or a wholesale club, and I think the word has to get out that those gloves are not just litter, it's contaminated litter. Whatever you touched with it is potentially contaminated, and you're leaving it for somebody else to pick it up. It's unsightly, and it's just unbelievably irresponsible. The other thing is that I've also seen people putting their mask on and off with their gloves on, and that doesn't make a lot of sense to me because they're touching the inside of their mask. They're contaminating the place where their mucous membranes are, and that's a way that they're going to inoculate themselves with the virus. And another question about masks, and I'll put this out there for discussion, is in today's Wall Street Journal, there was a article about the Hong Kong experience, and of course Hong Kong is part of China, but it's kind of sealed off from China to some degree. Hong Kong has had, as of today, it's a city of 7.5 million people. They've had 961 cases, not as of today, as of Wednesday. And it turns out that they've also had a much worse experience than we did with SARS and with MERS. And so their trains are still running, and they're still filled at rush hour, and their restaurants are still open. But everybody in Hong Kong wears a mask, not to protect themselves, but to protect everybody else around them. And the lesson that I got from that was that if you do universal masking, there's probably not going to be a lot of community spread. So in addition to the physical distancing, I'm just wondering if we're going to see a recommendation from our public health authorities that if you're going into a supermarket or if you're going into a public place, you should probably just put a surgical mask on or a heavy cloth mask so that you're not spreading your droplets to others. So put it out there.
Frank, this is Joe. I think what you're saying makes a lot of sense. As you may recall, I've worked in Hong Kong. Matter of fact, I worked there for a year. And with the ailments that they've had, the flus, so forth, they, unlike us, better prepared to deal with this epidemic. And as noted by what they're doing right now, they're wearing masks, most everyone, and the economy is cranking up, unlike ours, which continues to not move. So we can learn from them, and I said that a little bit the last meeting that we had a couple of weeks ago too. There's a lot that they do right.
Yeah. So Joe, why don't you, if you had any questions other than making a comment on what I said, why don't we just kind of take turns and take the floor? It's kind of hard to do this on a conference call, but why don't we just go one after the other? If you had any things that you wanted to bring up.
I do want to. I have a couple comments to make, but I'd like to focus first on what Brian was saying. That is signs to walk in one direction around certain high traffic areas, such as the Common. Makes a lot of sense. Can only help. And as such, I make a motion to place such signs designed by our Department of Health at the Common and anywhere else that department recommends, and I open it up right now for further discussion.
Yeah, I don't know if I can second your motion, but I would definitely speak in favor of doing that. I know that people in my own family like to walk and run, and they've been avoiding the common just for that reason, because it does seem to be crowded. People do, you're passing right past them. Who knows if they sneeze when you go by them, or if they cough, they get an aerosol. Now it's not just droplets; it can stay there for several seconds, suspended. I think it makes sense to have a direction, and the direction should, I don't know, just for simplicity, should probably just follow the direction of the traffic and just go clockwise. I don't know. That would be my suggestion.
And that's the place, that's probably the number one spot in town that people go to walk, other than around their neighborhood. It's hard to find a parking place around there. Forget it. It can really be tough. And other areas in the town, for example, Wire Hill, you can't walk there now. So where are you going to go? But you can go on the Commons. And as such, there were a lot of people there. So those signs, I think it makes a lot of sense. I think Brian's onto something there.
Yeah, and I think Steve actually brought it up that they're doing the same thing in the supermarkets. Is they're having unidirectional aisles, and perhaps the signs could say two things on them. It's like this is the direction if you want to walk the common, and maintain that physical separation of at least 6 feet. Joe, I'm going to just steal your place on the speaking list for just a moment. The president of the American Medical Association is a woman from Atlanta, and she's a psychiatrist. And I heard her talk on NPR, and one of the things she said is that social distancing might not be the right term. It might be better called physical distancing, because we do want people to be social. We just don't want them to be physically close to each other. And so I've started my own PC term of physical distancing to combat the social distancing. Go ahead, Joe.
No, that's really all I had to say about a suggestion. And I don't have any questions. I do have some comments maybe later in this meeting I can make once we go around. But, again, a motion has been made. Like someone has seconded it. Further discuss it, and let's move forward on that.
I'll second.
Perfect. Any further discussion on the recommendation? And I think the way the recommendation is right now is that the pedestrian traffic on the common is recommended to be in one direction. We'll say clockwise, and the signage should state that clearly, and also encourage physical separation.
This is Michelle, based on the previous conversation, if we're going to put something out, should we also not mandate but recommend the use of a mask?
That's a good thought. The CDC is already recommending it, so I don't know why we can't. If you find yourself not alone on this walk, recommend the use of a mask, or encourage, Board of Health recommends or encourages the use of a mask, especially if your walking trail is crowded.
I think it's just another reminder that that's another thing they could be doing.
And wash your hands when you get home.
That sounds good.
Anybody else want to weigh in? All right, go ahead.
Oh, I was going to say, Brian and I were talking earlier in another meeting, and I think sometimes for people the mask piece is a little confusing, because in the beginning it was, we don't recommend masks, and I think we have to just stress the importance that you're not necessarily protecting yourself, but you're protecting other people. And if everyone's wearing a mask, you know what I mean? We're all kind of protecting each other, and we're all in this together. And so I think some people wear a mask thinking I'm safe, from getting sick or whatnot, but I don't know if they understand sometimes the reason for the cloth mask or the surgical mask in public. Do you know what I mean?
Yeah.
So I think it's good to educate them as well regarding that.
Yeah. Brian, what would you suggest that we do in that vein? Brian's checking his email.
Well, we can maybe include something if Steve is doing the PSA on how to wear a mask and take a mask off and whatnot. We can maybe just put something in there on that as well.
Sorry, could you guys not hear me?
Yeah, no, we couldn't hear you.
Sorry.
We thought you were
The,
checking your email.
No, the mute button on my cord to my headset was pressed, not the one on the screen. Okay, so no, I think it's a great idea. I think that getting the word out there as to what the mask actually does is kind of key here, because most people believe that it protects them, and it's not an N95. Surgical masks and cloth masks don't filter anything aside from large droplets out. Anything aerosolized can get right through. And I think people don't understand that. And I think that's part of our messaging, I believe.
Yeah, the surgeon wears a mask to protect the patient. They don't wear their mask to protect themselves. So, but if everybody's masking, then everybody's protecting each other.
Right.
I think the CDC is recommending that people in public wear masks. I think that's one of their more recent recommendations. I don't think that they've made that forcefully. I don't think you need to wear a mask in your house, but when you're going to go out and you got to go out to the grocery store, and as the economy opens up, and at some point, you might find yourself being able to go into these businesses. I think that until we have a vaccine or a treatment that works, the only way that we can protect each other is to wear the masks. And, Hong Kong, that city of 7.5 million people, has, only a few more cases than North Andover does, a city of, or a town of 30,000 people. So I think that until we get to the next level, the only way that we're going to protect each other is to separate the virus from ourselves, and that's not getting close to people. Wearing a mask will allow us to still be able to do our daily functions, and I don't know. I think that message needs to get out. I don't think that we're gonna cure the epidemic from North Andover, but I think that if our people know that, at least we've done our job of protecting the people in our own community.
Hi, this is Daphne. I just have a question. That sounds great and everything else, and I'm glad that you guys are being proactive. I just want to know, are we going to recommend for the essential workers like a supermarket and so forth in our town for that to be mandatory as well?
It's up for discussion.
Recommended.
Yeah, I don't think we need to make it mandatory because we don't have enough masks to distribute. But I think that people should understand that best practices is for universal masking to the extent that it's possible when people are out in public. If you're walking on a lonely street, you don't need to wear a mask. I mean, that's ridiculous. But if you're at the Common, you probably want to put a mask on because there's a lot of traffic down there. I have one of my physician colleagues who was in a supermarket over the weekend, and she ended up leaving. She's like, "There's too many people in here, and nobody's wearing masks, and I don't want to get sick." So she ended up leaving. I'm just saying that I think we're probably a little bit ahead of the curve on this, but I think that we should get the word out that the evidence is that the populations who mask have a much lower incidence of community transmission.
Okay, yeah, we can definitely work on that. One of the things that they're talking about regionally, just in the public health circles, is requiring face masks or requiring employers to provide face masks for their employees, like the grocery stores and things like that. But I think just getting a recommendation out there that people should be wearing them, I think, is the way to go.
Employees and customers should be wearing them. Everybody should be wearing them.
Correct, yeah.
I can chime in quick too. I talked to the grocery stores today, and I think Market Basket and Stop and Shop, from what I understand, both offer masks to their employees. They don't force them to wear them, obviously, but I believe they do have them available in case they want to use them.
Okay, yeah, as long as they're available, we can definitely recommend that they have them and offer them to their employees.
You know, unlike an N95 mask, I'm not sure how much in shortage the surgical masks are, but it would almost seem to serve a public health purpose if they are available. If people going into, you know, Stop and Shop or Market Basket or the big stores were offered masks as they went in, you know, if that could be,
We can look into it.
you
I
know,
don't know.
it just seems like, you know, what are the places that people congregate in? You know, we're worried about, you know, the common, but you know, everybody's got to eat. Not everybody has to walk, and you know, as people go into the larger stores in our community, it seems to me that if they were offered a mask on their way in, they could actually keep that mask and reuse it when they
guess
go
we
other
can-
places.
I guess we can look at the supply and see what the availability is of surgical
Yeah.
masks and kind of talk to the stores about using them like that.
Well, you know, I mean, I don't know that we want to come up with that recommendation in this meeting, but I would very much ask you to talk with the public health authorities in Boston and see what they think of the idea of, you know, targeting the supermarkets, you know, the wholesale clubs, the places where people are still going, and seeing whether that's an idea that they want to get into, and that would be actually a good way of distributing masks to the population and getting
Right.
a population benefit.
Yeah, a sanitizing wipe for the cart and a mask for your face, and you're all set.
Yeah, so it's just a thought.
Now, I know
Frank,
this
I think you're gonna.
clarification on the mask is important, but I do want to get back to the motion that I made, which was seconded for the signs to walk in one direction. Is Tony there right now, by the way?
I don't think
She
so.
is, but her microphone is not working.
Okay, as you know, I gave some verbiage on that, and we may want to expand upon the verbiage. Frank had some really good ideas and thoughts to that end too. But I'd like to just put this to rest, and I know there's a lot of other things that we're going to be talking about tonight concerning the coronavirus. And
Right. Well, I think I can paraphrase your motion. So what we'll do is we've had some discussion. I haven't heard anybody speak against it, but if the recommendation was going to be have signs that recommend a single direction around the common for walkers, emphasize the physical distancing, and was there anything else in that and to wear a mask possibly?
Yes. Yeah.
Yeah. Okay. So those are that motion has the three little sub elements. Is there any further discussion before we go to a vote? Everyone knows what they're voting on, right? Okay, all in favor, say aye.
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 Hi.
Aye. Any opposed, say no. It's unanimous. The motion carries. So that recommendation will be carried out by Brian and Steve.
Thank you.
Frank, this is Joe again. I do have one question. I know that other people, you know, want to chime in too. Concerning the coronavirus, and this is primarily to medical people right now on this call. How quickly do the coronavirus symptoms hit you? That is, when do you know if you have it? Do you get that cold faster than you would, say, with the flu or pneumonia? And are tired faster, lethargic? So what's the timeline here? Anyone have an idea on that?
Why don't we ask Pat, who's our pulmonologist?
So again, the symptoms vary extremely, ranging from no symptoms at all, which unfortunately those are the dangerous carriers because of the lack of symptoms, but you can still transmit the virus. There seems to be more and more talk and literature coming out recently, talking about other ways of transmission, including just talking. is now being linked to transmitting the disease. As far as the exact timeline as to onset of symptoms, I've seen it vary from, well, I guess actually probably the bigger question and the problem is that a lot of exposures, we don't know where the first exposure came from. So how long the inoculation period was from the point of exposure to onset of symptoms can vary. I've really seen various literature on that. Frank, I don't know if you have any more point of reference as to exact onset of symptoms, but from what I've seen, it's been fairly variable to about 48 hours on.
Yeah, I've seen, you know, a few days to, you know, I don't know. Some reason 5 days kind of sits in my head, but you know, I haven't really looked at that question. It's a good question, but you know, you've got the asymptomatic patient. The other thing that I saw, Pat, was is that some people are much more infectious than other ones. So the people who are running the fever, those people appear to spread the virus much more efficiently than maybe the young person who's carrying it asymptomatically. And I don't think it's really known how infectious the young person who's carrying it asymptomatically is compared to the older patient who's like really sick with it and who's febrile. I think all infectious diseases follow a pattern where, you know, if you have one viral particle that touches a mucous membrane, that doesn't mean that you're going to get coronavirus. You need a certain number of viral particles in order to successfully colonize and cause a disease, to inoculate somebody. So I don't know. It's a good question, but I just seem to remember it's about 5 days in many people.
Yeah,
You're right, Frank.
Yep.
It's typically 2 to 14 days, with the average being 5 days.
Thank you.
Now, this that I asked from a personal perspective, I was in my barn today, and I started to sneeze a lot. And the first thing I said to myself is, "Oh my God, I hope I don't have the coronavirus." Of course, I just realized that a minute or two before then, I used a dust brush on a bench, cleaning it up. So I probably was some dust in the air. But I started to not panic, but feel uncomfortable. And I said, "Can the onset be that fast?" And I don't know, but it only lasted for maybe 30 seconds, and then it was gone, particularly after I left the barn.
That I will say with 100% certainty that no, it will not have that quick of an onset. And now, especially with allergy season coming out, I'm sure a lot of those questions will start happening more. Is this allergies, or does somebody have the coronavirus?
Yep.
Well, we have a couple of people who haven't really had a chance to ask questions or make comments. So let's hear from Daphne and Michelle in any order.
I can go.
Go ahead, Michelle.
I was just curious, based on our previous motion, if there's any other places. At the beginning of the call, Brian, you mentioned a lot of complaints about people congregating. And I saw what our neighboring community of Haverhill is kind of dealing with, and just wondering if there were other areas that we should be worried about or talking about.
I mean, the high school track does come to mind. There are a lot of people walking and running around the track as well. I would speak to the school department about maybe doing the exact same thing over at the track if they're going to keep it open. I mean, we do want people to get out and exercise, but we want them to do it safely. So if we did it at the Common, I think the track would be the next best place to do it.
That was one area I was thinking about. So
Okay. And then, I mean, we've closed the playgrounds, but every now and then you'll see like one kid on the playground by themselves with one parent. I'm not going to stop and say anything at that point, but I mean, people are out there and they are using the stuff.
And that's why when I made the motion, I did mention the Common and anywhere else that the department recommends. For example, it can be a little bit, the traffic can be a little bit, pedestrian traffic can be a little bit heavy around the library right now too, but nothing compared to the Common.
Right.
Well,
Yeah,
we're going to
get people there too.
we're going to get more traffic as the weather warms.
Yep,
Yeah.
absolutely.
This is Daphne. I know last time we were on, we talked about a shortage of masks for the front lines and so forth. How are you guys now as far as supplies? Face
Not
shields
good.
and so forth for the front line. Not good?
Not good.
Okay. And
It
Frank and
depends
Brian, can we
how
talk
bad
about
the
this
surge is.
offline?
Yeah, absolutely.
All right, thank you.
Do you want to expand on that, Frank?
Sure. The peak in Massachusetts is expected sometime around April. I think it's April 18th, according to the model that most people are using, and the peak is, I think, around April 16th in New Hampshire. I know that where I practice in New Hampshire, I know Pat does too. We just can't get. We've got about 60 days supply of PPE, and that's it. So we're kind of desperate. There's all sorts of counterfeit stuff out there, and a lot of it's going to New York, where there's a lot of activity, and to Boston, where there's a lot of activity. And those of us who are kind of out in the outlying areas are we're really struggling to get adequate PPE to the N95 masks, for the front line, for the people on the front lines, the people who are actually in the hospitals taking care of the COVID positive patients. So it's the only thing that might save us is just that the population density is lower and there's going to be less community spread just on that basis. I don't know, but I know that we've been banging the alarm. And I don't know. We're waiting for the cavalry. This is not the surgical mask. This is for the respirators, the N95 and things such as that.
Right. Okay. Okay. Anything else, Daphne?
No, nothing else for now. Thank you.
I had another question. This is Michelle. We have I know earlier we talked about the skilled nursing facilities and assisted livings in town. Just curious, do we feel we are well prepared for any positive cases and have plans in place with all of them and the first responders who are responding to those areas frequently and everything like that?
Caroline, you want to take this?
Can you repeat the last part of that? Because it was kind of echoey, sorry.
I know. I don't know why I'm echoing. I'm sorry. I just wanted to see if there was anything else we needed to talk about or anything else from your perspective that you need our support on to make sure that we're prepared should anything occur in any of those facilities. Do we have the proper precautions and are we kind of prepared?
So in terms of the long-term care facilities, they have been getting communications from DPH. We've been reaching out to them. They've had a lot of precautions in place. So like I said, they've been checking staff members' temperatures. Sorry, the echoing is throwing me off. They've also limited visitors. A lot of places aren't even allowing any visitors. And then the staff, they're trying to really just keep an eye on their temperatures. They're wearing masks, gloves. If there is a COVID positive patient, they are kind of keeping them isolated. The same staff, one CNA, one nurse, that kind of thing. In terms of our first responders, there's a state order that they get a list of all the addresses of the COVID positive patients. So when there is someone in town, the dispatch gets that. So if someone is called out for 911 emergency, they're aware ahead of time that that person was tested positive. So in terms of the long-term care facilities, and then we have had some cases, it seems to be kind of ramping up a little bit. I've been in touch with the state. I've been in touch with the long-term care facilities and just making sure that they're identifying close contacts. Those close contacts are being, quarantined at home. I think what some of the situation with healthcare workers we run into is that if they've been exposed, they're quarantined, they're asymptomatic, if these hospitals and long-term care facilities are desperate and are running out of staff and these people don't have symptoms, they can go back to work. So
Yeah, so
we're
we've
trying to, go ahead.
and we have actually delivered and given out masks to each of the facilities here, just to make sure they had enough on hand to limit any spread of any, obviously, workers to their actual residents.
I think one of the things that I have heard now twice, I got an email today asking for gowns. This is the second one, and I don't think we have ever had gowns in
That's-
our emergency supply.
That's one spot that we did not have, actually.
So that would be the one thing that I think we're lacking.
Yep.
Interesting. I guess for the general public, though, the hand washing is important, and the physical separation is important. If you do those things, we'll get through this. If you don't, we're going to continue to have community spread. So keep the distance, wash the hands, don't touch your face.
Frank, it's Pat. I have a question for Brian, and I also have a proper mask usage point that I see constantly. People pulling their masks down to talk and then putting the masks back up on their face when they're finished talking. So if that can be reinforced in the public service announcement of some sort, that would probably be useful as well. My question to Brian is, has there been any talk on the state level about, there's more and more talk now that because of the lack of a vaccine, of another potential surge of some sort in the fall?
There's different theories going around in terms of 1, maybe 2, 3 waves even, and they just don't know. There's speculation and there's discussions at all different levels regarding that, but there's no obviously set idea as to what's going to actually happen. So I think one of the things they did talk about was if they lift the social distancing or physical distancing requirements too quickly, you will see another large spike right away. I mean, within obviously the transmission period, so within 2 weeks after lifting everything, you'll see another huge spike.
Right. I think the word is that we're going to live in this new normal for a period of time and try to negotiate and figure out what are the things that we can do to allow us to resume some degree of normalcy, but at the same time keep that second spike from coming. I mean, we're pretty certain that convalescent serum seems to be useful, and what that implies is that people who have had the coronavirus probably do have some immunity. We don't know that for certain, but herd immunity is one way that the viral spread stops. That really requires over 50% of us to get coronavirus, and I think most of us would prefer not to test that.
Yeah, yes.
Yeah, I'll stop there. Who else wants to make a comment who hasn't had a chance to say anything?
Yeah, I'd like to address the effects of this virus on mental health. But first, a little info on the recent background of this virus. As many of you know, University of Washington Institute of Health Metrics, their model on the virus projections is considered to be a standard.
Joe, it's a little hard to hear you. Can you make sure that you're not on speaker and just speaking directly into the receiver?
Yeah, can you hear me now?
Yes, much better.
Okay, yeah, I have been on speakerphone. As I was saying, the University of Washington's Institute on Health Metrics, their model on the coronavirus projections is considered to be a standard, but it has overestimated the number of cases and deaths of this virus. even factoring in social isolation. And as such, their numbers continue to be revised downward. For example, 2 weeks ago, it was about 245,000 projected deaths in the United States. 2 days ago, it was 60,000. And I don't want to underestimate the severity of this problem, the severity of this virus. But the shutdown of our country is predicated on information and data that is old, that we're not there. And it appears that we never will be there. And as I said, I'm mostly concerned right now about the consequences of mental health problems. For example, to lose a job, prolonged isolation. There's marked increase in alcoholism, child abuse, spousal abuse, depression, confusion, functional decline, particularly among the elderly. In a recent edition of Time magazine, there's an article on the consequences of prolonged isolation, which includes a 29% risk in premature death, decrease in the size of the hippocampus, which is the part of the brain related to learning and memory, and it's equivalent to smoking 15 cigarettes a day. Just a social isolation. Now, there are things that we are doing in our town. For example, I was in contact with the director of the senior center today, Irene O'Brien, and she's at work every day, as many of other members of her staff. And the people that go to our senior center, not even on a regular basis, they all have received at least one call, if not a number of calls a day. So it says to me that it's really important. Can't underestimate the importance of just reaching out to people. And as we pivot from what our government can do, we should be pivoting to what we can do as individuals to help others. And our seniors are in need. And I tell you, the longer we have this social isolation, the worse it's going to be for our country. For example, in 2018, 50,000 Americans killed themselves. I wouldn't be surprised this year if it goes to 60,000 or 70,000. So, yeah, there are things that we can do to mitigate the problem, but it's going to get worse the longer we are down. Our country stays down. How we put it back, I don't know. Maybe the people that are young should go back to work first, say the people that are under 50, but it's going to be a disaster. Much more so than the illness itself. A question I have is the cure to the illness worse than the illness itself? I don't have that answer, but it's a question. So those are some of my feelings on this.
Joe, others are asking that same question.
I mean, if you take a look, for example, that the CDC, the U.S. death certificates, drug overdose, 67,000 a year, suicide, 50, alcohol abuse, 88,000 a year, and the coronavirus, right now we're talking about, well, maybe 60,000. But that's caused our country to go down. Not all these other problems. So it just, as an engineer and as a businessman, it just doesn't add up. I struggle with this. I really do. Our country is never going to be the same. Doesn't mean it's going to be worse. Doubt it's going to be better. But, and as I said, the last meeting that we had 2 weeks ago, worldwide deaths from pneumonia, 3 million a year. And right now, from the coronavirus, 83,000 deaths worldwide. So it doesn't. I can't put this all together. Maybe it is overreaction. I don't know. But, for example, on a personal note, a niece of mine had a baby today. I can't even go to the hospital. Not that I should go to the hospital, but I can't even look at her from outside because she's on an upper floor. Or look at the baby outside where the baby is right now in a glass area. Can't even go there. And I'm not unique. That's the way it is for everyone. So those are some of the concerns that I have on this. Are we doing too much? I don't know. I don't know where we're going to get the money to pay for this. Borrowing $2.3 trillion. The only way we can come up with that amount of money is to print more money and to borrow it. T-bills, bonds, and so forth. You know, then we're going to have inflation in a few years. It's a mess, the whole thing. So yeah, I know our focus has to be on what we can do to mitigate the problem, but there's so many other things that are so troubling. And if you take a look at politicians, I mean, every politician, if you're talking about local, state, federal level, all politicians want to do as much as they possibly can. They'd rather be seen doing everything possible to address the virus than not doing enough, which would be political suicide for them. So that's what they're doing, all they can.
Thanks, Joe.
Yeah.
Brian, let me turn this over to you for a moment.
Sure.
What do you need from us? What can we do to help?
I just need your expertise. You guys are in the field. You guys are seeing this from a different perspective, and I just need information from you guys. I need some recommendations from the medical professionals. I think that would be fantastic.
Yeah. Well, I think we came up with a couple of useful things. We're going to get the word out best as we can. And I'd really appreciate it. We didn't take a vote on this, but I'd appreciate it if you could, talk to the people at the state about maybe, doing an intervention and distributing masks in supermarkets.
I think that's a great idea. I'll definitely get on that. I have a call tomorrow morning at 9 with the state. I will definitely bring that up.
All right. Anybody else have anything that they're burning to discuss? We've been at this for a little over an hour now.
Just maybe a quick rundown from you and Pat as to what you guys are seeing in your practices, just in general from the office standpoint.
Pat, do you want to start?
Sure. So from an office standpoint, we have essentially gone to 100% either telemedicine, which is video-assisted feeds to patients. So we're doing visits in patients' homes by video. Also, we're doing telephone visits. All insurance companies and Medicare, Medicaid have significantly lightened up their criteria to allow us to do this, to practice appropriate physical distancing, and making sure that we're able to still be in contact with all of our patients. I will say from a inpatient standpoint, since I do round in the ICU, we've, for the most part, again, I'm in New Hampshire, as Frank is too. It's been a steady influx of critical care patients requiring to be placed on breathing machines, ventilators. It's by all means not overwhelming, but our surge is roughly about a week behind Massachusetts. We are well prepared and just waiting for a surge, and there's no way to predict if or when.
So you guys are under capacity, which is good. Like I said, I've heard from the area hospitals around here, from different parties, that they are right below, but they're approaching that max capacity at this point.
Yeah, we're not quite at max capacity at the Seacoast. We're a little bit. Our ICU is busy. We have a dedicated COVID floor, but it's not that bad. My exposure in the hospital is generally, people still have things like gastrointestinal bleeds, and they have food impactions, and unfortunately they still get cancers. A lot of patients have actually been very have self-deferred their own care because they're afraid to come into the facilities. We're actually locked down. You can only get in after getting screened. So you walk through the front door, you're immediately greeted. You get asked 3 questions about coughing, sneezing, headache, fever, things of that nature. You get your temperature taken, and they want to know why you're there because we have a no visitor policy with very few exceptions. So And that's done for employees too. Employees and medical staff, nursing staff all go through the same screening at the front door. So the access is controlled, and you only get in. There's as far as the office, we've done exactly what Patrick just described. We're doing almost all virtual visits. If you have something that requires a physical exam, we do bring you in, but you do have to go through that screening. And our resources, all the medical assistants and nurses that we have, normally we're keeping, we have two teams. So we have one team in on a few days and the other team in on the other few days, so that we're not going to lose all of our, in the worst case scenario, we don't want to lose all of our ability to take care of patients. So we're actually separating the physician and nursing teams from each other, so that if one team goes down, that we have others that can do the work. We're looking actually towards trying to wind this down over the next month or so, and trying to get back to some semblance of normal order, because we know that a lot of the care that we've deferred, while maybe it's not emergent, it's still necessary care. And so we're trying to figure that out right now, because we have a significant backlog of things that are the high priority rebook. So all those elective procedures that sometimes are elective, but oftentimes they're not, and they have not been getting done. It's creating a backlog, and we had before I got on this conference call, I was in a conference call with my group about how we're going to unwind that, but yet still maintain physical separation. So I don't think we're going to reopen our waiting room, for example. What we'll probably do is, have you present yourself to the front door. You'll log in. We'll take your phone number, and we'll text you when you're ready to come into the building, and you'll turn your car radio on and chill out and hang out. And when you come in, and when you leave, and then the next person comes in. So there's going to be a new normal, and we're still trying to engineer how that's actually going to work. But we're probably going to be in that mode for several months until we get a vaccine or an effective treatment, or if we clear this thing miraculously.
Okay. Thanks, Frank and Pat. I appreciate that.
There are several major indicators of good news. One is the stock market. It's rebounded about 40% since its low a month or two ago. The other is that I don't think that there is the concern now that there was at that time a month or two ago of the collapse, and with the collapse of our health system. And getting back to the University of Washington's Institute of Health matrix, they're saying that although people will still be sick, the deaths should pretty much subside by I read June, and then I read August, so I don't know. But it looks like there's a period of time that maybe they won't completely subside, but they're not going to be as horrific as they are at this particular time. So I think there's a light at the end of the tunnel, and I trust more what's happening in the stock market than what I hear from the talking heads on TV, many of whom don't know what they're talking about anyway. So there are good signs.
Well, Joe, it's Pat. I would just say, speaking from as a boot on the ground, taking care of these patients, it's scary. It can happen quick, and I definitely am more in favor of we need to prolong this physical distancing as long as humanly possible to avoid another potential surge, because or until we get a virus, or until we get 5 minutes rapid screening done, it can come on fast. It can really affect the elderly population and people with underlying medical problems, and I've seen it firsthand. So I even though yes, there could potentially be a light in the end of the tunnel, I still think we have quite a long ways to go.
Yeah, and consistent with what you're saying, Pat, there is they're talking about a blood test that will soon be available to determine who already has been exposed to this virus and don't have to fear going back to work or school. So perhaps these people should, I even heard, perhaps they should be carrying a card of immunization and get on with their lives, get on with their normal lives. Again, the people that are most vulnerable, the people that are older than 50, not people that are younger than 50, although some of them do get sick and do die. without other complications. But it's the elderly that is of most concern. So.
Well, Joe, this is Frank here. I would say it's a little bit less predictable than that because there are young people who have no symptoms who do get severe disease and do die from this. And it's not as many among the younger cohort, but we don't really have a way to figure out who those people are. Now, there might be some behaviors and things like that, but vaping, for example, is probably not a good thing to do right now. I'd have to agree with Pat. I think that I actually agree with both of you. I think we have to find a way to get our country working again, but at the same time, we have to do it in a way that is smart and is not just hopeful. I think we should all be hopeful, but I think the decisions that we make as people in public policy should be based on the best evidence that we have, and just recognize that sometimes there isn't evidence, and you have to use your best guess. But there's a lot of experience around the world right now. Sweden, for example, didn't close their schools, whereas the other Scandinavian countries did, and so we're going to see what the effect of school closings is. Maybe it turns out that it doesn't matter, and maybe we can get the schools back into Hong Kong with the masking, and that seems to work, and they do that in Singapore too. So these are very population-dense places that have not had as much disease as others. So I don't know. I'm not the expert on this, but I think that I don't know if I'm ready to say that declare victory and open everything up again, because I think we'll have a disaster if we do that.
Oh, I agree with you there. Although that is happening in a piecemeal fashion already, particularly in Europe, like Austria, for example, after Easter, they're going to be approaching, they're moving towards normalcy. Whatever that means in this day and age is hard to say. But industries will be starting up. I saw a picture, I think it was on TV, of people shopping right now in the markets of Venice, Italy. Many other countries are slowly opening up. I hope that happens to us soon. Keep my fingers crossed and hope that we don't have a second wave of this coronavirus.
Yeah.
Problem is, no one really knows. It's just a judgmental call.
Well, there's places that are ahead of us, and we can learn. If we see something bad happen over the next few weeks in the places that liberated too soon, then I think we'll know what the answer is. And
Right.
if we don't see it, then we'll at least have some confidence that I don't want to be the first kid on my block with this new bike. That's all I can say. I'll let somebody else figure out how to ride it, and then I'll take my ride.
There you go.
All right. I will entertain motions at this point.
I make a motion to adjourn.
Second.
Sorry, not yet. A couple things.
All right.
Almost.
You're like,
Almost.
we already have a motion and a
All right.
All
put it
right.
in
That would be
discussion.
considered discussion.
Okay. We do have a variance request on the table on the agenda.
Okay.
It's a camp variance for Ready Set Row. Our new regulations require them to have a nursing staff, a healthcare consultant, as a licensed registered nurse or doctor. And I'll let Caroline take it a little bit further. She's been dealing with them with this variance request. It's basically they're looking to alleviate that requirement for their camp, and they're an older camp. And I'll let her take this. So, Caroline.
Hi, sorry to switch gears completely here. I don't know where we'll be at in terms of camps, but they had asked to apply for this variance like a month ago, but in the heat of everything, they just are trying to make a decision. So they're a rowing camp that is for ages like 14 and older. They have run at Brooks for the last 2 years, I believe, and normally had a nurse practitioner who also was a mom who was their healthcare consultant. They do not at this time. So in their letter for request, they have asked, due to the fact that they had already signed a contract with Brooks back in November, that they, if it could get waived for this year. They were supposed to run from June to mid-July or first week in July. And because of the length and extent of that camp, they actually, with the new regulation they pulled out and are just trying to now run a 1-week camp at the end of August. And so she's just looking to see if she could do that without the nurse. It's an overnight 1-week camp. So she's looking for a variance to run that without the nurse. In her letter, she mentions that she has staff. I'm trying to find her letter right now. She has her healthcare supervisor who's CPR, first aid. She also has trainers who come in who will give medicine. And then they also have the healthcare consultant who's very involved and, reviews everything prior to the beginning of camp.
So just educate us, Caroline, on the origin of the requirement to have a medical personnel at the camp, because that was not always a requirement.
Right. So it's something that we changed this year because we had a situation where there were a couple of situations within one of the camps that they did not have a medical professional. It was an overnight camp, a different camp from this one, and they had some children with multiple medications, 15 plus, and other children who had medications that were to be administered by a medical professional as needed in the event that this child had a seizure. So there were situations that in years prior when that camp had run under a different healthcare consultant, they required a nurse to be on site all, 24 hours of the day. And so moving forward, we realized that it was every year we were kind of battling the same battle. And in our thought process, it was, we want to do what's safest for the children, for the campers, because as an overnight camp, things are going to come up. There are going to be kids who are, needing medication that you can't always, you can't be denying these kids access to a camp experience. So just in the interest of safety, we had changed it to have it be a nurse for overnight camps.
Mm-hmm.
So she was kind of taken back by the change and was looking to see, if she could get a variance for this year because she has, she's been very organized. She has everything in place. She gets me everything in time. And the only problem sometimes is that we can't always get the medical records and the history and what they're on for medications until like a week or two before camp. So if there is something that gets flagged and they do need someone, we won't know that until the last minute.
Okay. So what's your recommendation?
I think, I know for a lot of people it's hard financially to have a nurse be on site for 24 hours for an overnight camp. I get that. I think we changed the regulation for a reason. I think I trust this person. I don't feel like she's trying to outsmart me or kind of wiggle her way around what we have in place. I think she just was anticipating running her camp and, thought she'd be okay, had already signed the contract and, hasn't been able to find anyone. She lives out of state. She's coming from North Carolina. To find someone here in Massachusetts has been challenging for her. So I think that's also kind of been a struggle for her as well. I do trust that if something were to come up, she would do the right thing. She wanted to run everything by her legal department. So I think, she's very responsible as the camp director. And so I trust in that. So, I mean, it's hard because we just changed the regulation. So I believe in what we did, but at the same time, I know there needs to be some wiggle room as well for certain situations.
Right. One of the things that when we've been asked to give a variance, one of the things that we've always discussed as a part of that discussion is if we're setting a precedent that will make it more difficult to enforce the regulation down the road, and should we condition the variance if we feel that it's worthwhile to some sort of thing that would discourage people from just saying, you know what, it's expensive to have a nurse, and I don't want to do it.
Right. No, I understand.
Further discussion from the board?
Yeah, I'd just like to make another point. There was an article in Forbes magazine concerning scams during this coronavirus epidemic, and it said...
You know what, I'm going to rule that discussion out of order right now because we're discussing a variance. Discussion is on the variance.
Oh, I'm sorry.
No, I'm sorry, Joe. I didn't mean to do that to you, but we need to stay on topic.
I wasn't focused on what you were saying. My mistake. Go ahead.
So on the table is a discussion on whether we should give a variance to allow them to not have a nurse present 24 hours, whether we want to approve that or not, whether we want to attach a condition to it. Caroline, before we have somebody else chime in, let me just ask a question. Do you get a chance to review the records before the camp opens?
I do, yes.
Okay.
So I typically, and they've been good. They've have everything in well in advance. Like what I was saying in terms of the time frame, we have set it up so for 2 weeks before the camp starts, I would review all of the campers' records and whatnot. Since this camp isn't starting till August, we can, set it earlier so that those records come in earlier in the summer, and so I can review them well in advance. And if there was something flagged, we could discuss it at that time. I think it's hard once things are already in motion, once they're already planning to run, they already have everything in place, then to try to find something last minute makes it a little difficult if we were, because Brian and I had discussed, well, why don't we kind of leave it up to our discretion? But I think there's too much gray when you do that.
Right. So how about if we condition a variance on having the records available by a time certain, and if they're not, then the variance will not be valid.
Okay.
And I'll let you decide how much time you need, and then we'll just we could make a motion to approve a variance conditioned on the timely review and set a deadline so that they'll know that they have their variance, but they'll know that they have their homework to do, so that we're not chasing them. I hate chasing people's homework. Yeah, so
All right.
I'd be willing to consider it. If you say July 1st or July 15th or whatever you think you need, we'll incorporate that into the variance.
Okay.
Further discussion on the variance. Can I have a motion? Everybody's on mute.
Yep. Can we get a motion?
So I can suggest what the motion could be, but I can't make it as the chairman. So I will suggest that somebody move to approve a variance to allow them not to have a 24-hour nurse, conditioned that all of the medical records are available for review by the North Andover Public Health nurse by the date of Caroline fill the blank.
I make that motion.
All right. I like that.
And Caroline, what's the date on the blank?
Let's do July 1st.
July 1st. Okay, so provided that the medical records are available for review of all campers by July 1st by our public health nurse, I would approve a one-time variance and let it be known that for next year, they'll need to make sure that they adhere to the regulation.
Thank you.
All right, is there a second to, I think Michelle Davis made the motion?
I second.
Okay, it's been moved and seconded. Is there further discussion on the variance? There being no discussion, we'll move to a vote. All in favor, say aye. Aye.
Aye.
Any opposed, no. It's unanimous. That way we don't have to take a roll call. So the motion carries, so the variance is approved. All right, so you guys will communicate that to the camp director. Since I so rudely interrupted Joe McCarthy, you had one more point to make?
No, on the contrary, you didn't really interrupt me at all because I was going in a different direction. As I was saying, there are a lot of scam artists out there right now. They're texting, emailing, calling, and so on and so forth, trying to get money to address this coronavirus problems. And speaking of money, you know, this $2.3 trillion that the government has approved to address the coronavirus problem. Any altruistic program that the government has, the numbers that I've read in the past are like 25% skim from the top. So from my perspective, going by these numbers too, it looks like about $500 billion are going to be lost. Is what it is. It's well, I have nothing to say.
Right. One more thing
Yep.
that I had to bring up to the board. We've gotten so far just one inquiry regarding ice cream trucks. One of our vendors, I believe, reached out to what we're going to be doing. Wanted to just run this by you guys. I think with everything going on, it would be prudent to withhold issuing any mobile ice cream food truck permits for the foreseeable future, at least for the next month or so. We can revisit the issue at the next Board of Health meeting or put it off until the May meeting.
So Brian, when would we typically issue the permits? When would the permits? When could you just apply for one in the spring, and if you wanted to start on a warm day in April, you could do it?
Yep. So yeah, they would start coming in now as the weather starts to turn nicer, and they start getting their seasonal stuff lined up.
All right. So I mean, I'm gonna take Joe McCarthy's point. At this point, it's like you know, we're not in the business of keeping people from making a living. I think we should probably discuss it at another meeting, but I would suggest that we not approve any right now, but that we'll consider opening it up with some sort of mitigation strategy.
Okay.
What do you think?
I completely agree. I think giving them out right now, if anybody calls up and starts to file an application, I think is too early.
Yeah.
Let's hold off until a meeting down the road, and we can discuss it again.
So we have another meeting at the end of the month, fourth Thursday of the month, and we have our usual meeting at the end of May. This is an extra meeting. It's not really a special meeting, and it's not a public hearing, but it is an extra meeting just because there are topical issues that needed to be discussed. But if we need to have another meeting before the end of May, we may schedule one too. We'll see.
Yep, and we'll be in contact about that.
All right. Good. What else?
That's all I got.
All right. I think that there was a motion to adjourn, and I didn't hear a second.
I seconded.
All right. So it's been moved and seconded, and there will be no discussion. All in favor, aye?
Aye.
Aye.
All opposed, no. The ayes have it. We are adjourned. Thank you, everybody.
Thank
Thanks,
you.
Frank.
Have a good night, guys.
All right. Bye,
Good
everybody.
night.